It's impossible to keep patients out of hospital. That was the phrase skeptics used to echo for years. Yet here we are, discussing one of the most audacious new plans that aims to treat more people at home or in a familiar community setting instead of in a hospital ward. So, what on earth is happening behind the scenes in Oxfordshire, and why should you care? Today, we are going to plunge deep into this remarkable initiative to see how it not only shakes up the way medical treatment is offered, but might also reshape healthcare in unexpected ways over the coming years. In this episode, we will analyze the heart of the matter, a pioneering approach to healthcare called the Better Care Fund, where local health and social care services are joining forces on a grand scale. We will examine why a plan that sounds so simple, offering hospital-level treatment in people's homes, could spark a ripple effect across entire communities. We are talking about improved discharge methods, the introduction of specialized teams, and a new strategy to make sure people get care exactly where they feel most comfortable. But that is just the tip of the iceberg. Stick around, because we will reveal how supportive services, urgent community response teams, and an innovative single point of access are all interconnected pieces in this evolving puzzle. We will also delve into the human side of it. How are families responding to the promise of shorter hospital stays? And does this symbolize the beginning of a transformation that might sweep across other counties, perhaps even internationally? By the end of this deep dive, you will have fresh insight into how exciting and game-changing a bold plan for hospital-at-home services really can be. First, let us turn back the clock briefly. Can you imagine how the term hospital once conjured up images of fluorescent hallways, busy nurses' stations, and long, often dread-filled nights? Recently, healthcare leaders in Oxfordshire decided that does not need to be the norm for every patient. Their goal is to shift a noteworthy portion of medical interventions to community centers or patients' own homes, providing the kind of environment that fosters less stress and more personalized care. Behind these changes stand intriguing figures and targets. This year's Better Care Fund amounts to $80.6 million, which arises from a shared health and social care fund surpassing $500 million. Although many of us might hear millions and imagine intangible sums, these carefully allocated resources are intended to flow from acute care hospital pipelines into community-based programs. That way, an older adult with mobility issues might not need to endure a stressful admission just to adjust a medication dose. Instead, a local nurse or physiotherapist team could address the situation in real time in the patient's own room, ensuring continuity of care without the disruption of an ambulance ride. Hence, what once sounded like a pie-in-the-sky ideal has grown into an actual funded plan that unites the National Health Service with the Oxfordshire County Council. It might surprise some to hear that these organizations have a track record of working together for a while. However, they once focused mostly on discharging patients faster and more efficiently. Although faster discharges were a step in the right direction, officials realized that people were still being admitted for reasons that could often be prevented. The joint approach has now shifted to preventing unnecessary admissions in the first place by expanding and refining community health solutions. At the forefront of this ambitious overhaul is Dan Levison, the Director for Places and Communities for Buckinghamshire, Oxfordshire, and Berkshire West Integrated Care Board. He highlights an overarching vision to deliver care at home and in surrounding communities, so hospital beds are reserved for those who truly need them the most. For years, health services have witnessed the downside of unnecessary hospital stays. Patients lose muscle mass, independence, and sometimes even a sense of autonomy when confined to a hospital bed for prolonged periods. By offering robust services at home, the driver is to retain or even strengthen that sense of independence. You might be thinking, all of that sounds glorious in theory, but does it actually work? One compelling figure they point to is a 20% reduction in the average length of hospital stays across Oxfordshire. That means out of 5 days, someone might have stayed in the hospital before these changes. It is now 4 days, or even 3, depending on the condition. It may not seem like a big jump on paper, but each day spent in hospital can be physically and emotionally grueling. If removing just 1 day of that experience leads to better morale and quicker recovery, then the system stands to win on multiple fronts. Let us pause for a moment to reflect. Feel that spark of curiosity about how these plans could differ from the usual script we have heard for decades? If you are fascinated already, do me a friendly favor. Consider giving a nod of support, maybe drop a like, or share what surprised you the most so far with a friend. That kind of engagement from you helps people discover the real stories behind these transformations. Now, let us dig deeper into how money is being allocated. The funding is prioritizing expansions of existing services that enable individuals to remain where they are most comfortable. A shining example is the Urgent Community Response System, which is being bolstered to offer an alternative to paramedics taking someone directly to hospital. Let us imagine Allison, a 70-year-old coping with mild dementia, but very independent when at home. She trips on a loose rug and her ankle is swollen and painful. Under the old structure, paramedics might transport her by ambulance, leading to hours of assessment, potential admission, and days stuck in a busy hospital wing. But now, imagine a scenario where a specialized urgent community response team arrives, equipped with the right tools to assess her injury. They might set up an immediate at-home care plan, coordinate with a local GP, or arrange a follow-up with a physiotherapist who visits her living room. Allison avoids an unnecessary admission, freeing up a hospital bed for someone more critically ill. This is exactly what the integrated neighborhood teams hope to achieve, bridging the gap between hospital-level severity and the day-to-day realities of patients who do not require acute care. Sometimes, we forget that a hospital environment can be intimidating and disorienting, especially for older individuals or patients grappling with cognitive issues. By limiting the time they spend in that environment, officials believe that these individuals will stand a better chance of preserving not only their physical health, but also their mental acuity. And that is not the end of the story. The blueprint also includes a single point of access for community services. Instead of bouncing between phone numbers and departments, people can reach out through a central point, and from there, they are navigated to the correct resource. Maybe they need a district nurse, or perhaps a reablement support worker who can assist in regaining certain life skills. For the family caregiver, who might already be juggling multiple responsibilities, this streamlined approach can alleviate a ton of stress. No more frantic searches for the right phone line, just one door to knock on, and the help aligns accordingly. One of the more intriguing expansions is the so-called hospital-at-home service. It may sound surreal to say you can receive genuine hospital-level care in the confines of your own living room, but that is precisely what some specialized teams are now delivering. We are not talking about a simple check-in. Depending on the resources assigned, it can include administering IV medication, advanced wound treatments, or monitoring vital signs with specialized equipment. For certain conditions, pneumonia, for instance, it might mean that a patient who would normally be staring at a ceiling in a hospital ward can remain in a familiar place, surrounded by personal objects and supportive friends. For the staff themselves, this shift represents a new challenge and opportunity. Nurses and therapists who once exclusively worked in hospital corridors are now stepping into communities, learning to navigate patient residences up close. This brings a layer of insight and empathy that can get lost behind the routine hustle of hospital life. And from a purely logistical standpoint, it helps reduce overcrowding in busy wards. Less congestion in hallways means shorter waiting times for people who do need to be in the hospital for critical procedures or urgent emergencies. You may be wondering, how can a single region push all these changes and hope they will stick? That question leads us straight to the conversation about integrated care. That word integrated is not just a buzzword for synergy. It encapsulates the alignment of multiple sectors: healthcare providers, social care professionals, mental health services, and sometimes even charities, to create a more holistic system. Everyone talks to each other, shares data responsibly, and collectively decides on the best route of care for the patient. If done right, it eliminates the dreaded fragmentation that plagues medical services in countless regions worldwide. There is no shortage of ambition here. With existing yearly NHS spending for Oxfordshire estimated to be anywhere between $1.5 billion and $2 billion, there is an obvious impetus to redirect funds into programs proven to be both cost-effective and beneficial in terms of patient satisfaction. The challenge, of course, lies in balancing immediate demands, like the surge in hospital admissions during seasonal flu periods or other public health crises, with long-term strategic goals. But the promise is clear: fewer nights in hospital beds, fewer tearful phone calls from anxious relatives, fewer chances for someone to come down with a hospital-acquired infection, and hopefully a less overburdened, more agile medical network. So, the big question: does this open the door for a revolution in how everyday healthcare is delivered, not only in Oxfordshire, but possibly nationwide? let us not get ahead of ourselves just yet. Administrators caution that they are still fine-tuning the approach. Each neighborhood might have unique hurdles, perhaps a lack of local nurses, or public transportation issues for those who need a ride to a community clinic. For instance, in more rural parts of Oxfordshire, the challenge might be ensuring that the most vulnerable are not left out, simply because they reside in a remote hamlet. At the same time, we see a flicker of genuine optimism. Healthcare professionals speak about the sense of personal connection they feel when treating someone in the environment where they live. That synergy between patient and care worker sometimes fosters a stronger trust that can be harder to establish in the whirlwind of a hospital corridor. And from the perspective of the family caretaker, the convenience is second to none. What is especially captivating is the way the region has begun exploring advanced technology to support these innovations, from portable diagnostic devices to telehealth systems that let a consultant check a patient's vitals in real time without requiring a physical presence. That might be a peek into a broader implementation down the line. Remote consultations for standard cases like mild infections, basic routine tests performed by roving medical teams, and a digital platform connecting many service providers. Imagine a future scenario where you have a single app or line to call, and within hours, a specialized team arrives with everything they need to guide you through your acute health issue without a hospital stop. In revealing these details, we might focus too heavily on the practicalities, but let us not lose sight of the human stories at the center. Picture a father of small children who can now recover from minor surgery at home with periodic nurse checkups instead of missing precious evenings spent reading bedtime stories in the hospital. Think of an older woman who lives alone who might otherwise face days in a shared hospital ward. Instead, she has a dedicated physiotherapy plan from a visiting team that encourages her to walk a little more each day in the comfort of her kitchen and living room. These tales resonate strongly with the core principle behind the plan. Health and care systems should revolve more naturally around the patient's own routine, instead of forcing the patient into an often disruptive environment. For those who doubt the viability of such a shift, let us look again at that figure. A 20% cut in the average hospital stay duration is not trivial. It is a testament that something in the synergy between social care and health is working. Could that figure continue to drop? Possibly, if the community services prove able to handle an increasing load of complex cases without burning out staff. Because that is a crucial point. Can the workforce keep pace with these lofty ideals? Care workers, district nurses, physiotherapists, mental health practitioners, and administrative support staff are all critical cogs in this wheel. If the plan tries to expand too fast without ensuring robust training and adequate manpower, it could hit roadblocks. However, officials appear to be aware of this pitfall, which is presumably why they emphasize integrated neighborhood teams. By structuring smaller, specialized squads, each one tasked with a defined community area, it becomes a bit like adopting a local, personalized approach. The staff gradually become familiar faces to residents, forging a sense of trust, rather than feeling like they are part of an enormous, impersonal healthcare bureaucracy. Patients begin to perceive a caring, cohesive family of professionals in their own locale. That is a subtle but powerful dynamic shift. Naturally, the plan extends beyond just logistics and finances. Part of strengthening home and community-based care involves addressing the entire ecosystem, from sanitation and mental health services to telehealth solutions and after-hours support. If an urgent matter arises at 2 o'clock in the morning, will the single point of access still be as seamless, or will it divert to a standard emergency number? Sorting out those details can be the difference between a truly transformative system and one that only partially meets its goals. Yet the impetus to solve these issues is driven by both financial practicality and moral conviction. Everyone recognizes that if you save enough hospital beds for the truly critical cases, you not only deliver better care, but potentially cut back on system-wide expenses. One might expect that local advocacy groups, charities, and social organizations will also come into play. If, for example, an older resident has a borderline living situation, selecting between different types of assisted living, perhaps a specialized volunteer driver affiliated with a local nonprofit can bring them to and from community rehab appointments. If an individual suffers from loneliness, a social care partner might step in with a befriending service. Those supportive elements can boost recovery outcomes in ways that purely clinical treatment cannot. With all this talk of collaboration, let us not forget that large-scale innovations like these are never completely flawless. There could be pitfalls, communication breakdowns between different agencies, staff shortage crises, overspending on certain new technology without guaranteeing results, or people's reluctance to trust clinical treatment offered outside the hospital environment. And that, ironically, leads to a dimension rarely discussed. We, the public, have grown to think of hospitals as the be-all and end-all of quality care. Changing that collective psyche might take time and consistent educational campaigns to reassure people that hospital at home can be just as safe, sometimes safer, than the traditional inpatient experience. If you find yourself nodding along and feeling inspired by the vast potential of these ideas, why not take a moment to show your support? You can consider subscribing to stay updated on the unfolding journey of health and community care. It is a small action on your part, but one that can help spark dialogue around how we rise to modern healthcare challenges. So, then where does the narrative go from here? The next few years will likely be about refinement. That might mean updating standardized procedures, improving training for staff who traverse city blocks and country roads for home visits, and scaling up telemedicine. Administrators, medical professionals, and patient groups will almost certainly engage in a continuous loop of feedback and adjustments. Nevertheless, that is precisely what keeps this story riveting. Every small victory in a village or district, perhaps lowering avoidable admissions by even 5% in one area, becomes a building block. If the idea holds up under stress, it could be expanded to bigger populations, possibly even anchoring a blueprint for the entire country. And that is exciting news, especially in a time when the pressing headlines often revolve around healthcare crises. Let us not ignore the global perspective. Across the world, nations are grappling with aging populations, rising expenses, and workforce shortcomings. If Oxfordshire's blueprint proves practical and cost-effective, others might replicate it in their own contexts, whether that is in more rural settings or heavily urbanized ones. At that point, the concept of hospital at home might transform from an emerging practice to a standard expectation, forging a cultural shift in how society views personal health management. Still, caution remains. Even a meticulously planned initiative can face turbulence when real life does not align with even the best predictions. Brexit, global pandemics, economic downturns, these sorts of macro forces can put tremendous pressure on local resources. But the resilience of any good plan often lies in its adaptability. As health leaders gather more data, they can identify what part of the strategy is or is not working, and pivot accordingly. Without that constant willingness to learn, a brilliant vision can rapidly become an underwhelming footnote. Yet the narrative so far is anything but underwhelming. The pilot figures confirm that cutting down on hospitalization time is no fantasy. The enthusiastic push for integrated neighborhood teams and hospital at home signals a new era where healthcare agencies say, "We hear you, and we see you want to stay in your own bed." Indeed, the Better Care Fund stands as more than just a monetary reservoir. It is the financial backbone that allows these teams to spread their wings, innovate, and become accessible to ordinary people. Even as we measure the success of this project, let us highlight small but undeniable wins. A mother in a quiet suburb caring for her chronically ill child, who no longer needs to worry about the ordeal of hospital stays. A retired teacher who can continue reading her favorite stories by her own fireplace while receiving intravenous treatment. A father who recently underwent an operation and recovers quickly in the comforting presence of his loved ones. These personal vignettes illuminate the value behind the initiative. For every statistic or figure we cite, there are real lives behind the data. Real families who are profoundly grateful for a shift in the system that once felt intangible. Another facet often overlooked is the mental health impact of prolonged hospitalization. Humans are social creatures, yes, but not always in the clinical environment of a ward. We thrive when we can maintain a sense of normalcy, whether that means a favorite hobby near the living room window or the companionship of a family pet. By bringing care directly to a patient's personal space, these programs may help reduce the emotional toll that is so often a side effect of being away from home. And mental well-being, as many experts argue, is tightly interwoven with physical healing. As momentum builds, we can envision more specialized offerings. A cluster of community-based mental health professionals supporting patients following major surgeries, mobile labs visiting rural lanes, equipped to conduct vital checks, and advanced monitoring devices that feed information back to a local control center, letting doctors intervene early if they detect a pattern indicating complications. The notion of synergy truly comes to life when multiple pieces of the puzzle, public health entities, hospital systems, local councils, technology innovators, and grassroots volunteers, operate in tandem. Major leaps forward often come with challenges, but the unstoppable wave of progress rarely halts. In an era when we have advanced scientific breakthroughs and digital transformations happening regularly, it seems only natural for the actual delivery of healthcare to also evolve. And that is precisely what Oxfordshire is attempting, to modernize not just the tools of healthcare, but the philosophy behind it. Instead of anchoring medical care to hospital buildings, the plan is to anchor it in the communities themselves, right where individuals live out their day-to-day lives. Now, as we wrap up this look at the region's bold push to treat more patients at home, here is a final thought. Healthcare is ultimately about people. People who need the comfort of familiar surroundings to heal more swiftly. People who crave a helping hand without uprooting their daily existence. People dedicated to bridging the gap between the conventional hospital scenario and a more humane, community-driven future. In short, it is about you, me, and everyone who has ever felt that dreaded anxiety of stepping into a hospital corridor. Stay tuned, because the future might see expansions beyond what we can currently imagine. And if you want to remain part of this conversation and find out how these initiatives progress, consider following along and sharing your thoughts. After all, innovative ideas flourish not only in official boardrooms, but also in the hearts and minds of those who believe real change is both necessary and possible. So, the next time you hear about a friend experiencing a health scare, remember that they might be able to recover, quite literally, in the comfort of their own home. The plan, the resources, and the teams are lining up to make that a reality. We are witnessing a subtle revolution, a recognition that hospitals should be the last resort, not the default. Oxfordshire is shining a spotlight on that principle, harnessing the synergy of health and social care to rewrite the narrative of patient treatment. Will it be the first domino in a chain of transformations that extends well beyond its borders? Let us stay engaged, keep asking questions, and see how this story ultimately unfolds.